is so hard to talk about race. And so in terms of like thinking about this conversation, I've done like a way longer portion of this training. And usually the first place that we start off with is identifying and looking at ourselves in terms of, are we racist? Are we not racist? What is racist? What is not racist? And so first place I'll start is with myself. So I'm from Washington, D.C. My mom is from Opelika, Alabama. My father is from South America. In terms of my household, I was a person who felt like I grew up in an anti-racist household. In terms of inside of my household, I lived in a household that was very affirming in terms of me being a Black individual. I was taught to that everybody is equal, to treat others well, and to be an advocate for social justice. So I thought that I was really anti-racist. And as I did more and more work, I could identify not only the racist ideas that I had about myself, but then also the racist ideas that I had about others. And so in terms of thinking about that, that is kind of like the place that I want us to start with, that we all have racist ideas, that we all share racist ideas. Often we think of racist ideas as something that just is housed in terms of white people. But I also had negative ideas about myself of what it meant to be Black, because I was a member also of the same society that everybody else is. And so while I not only had negative ideas about being a Black person, I also had negative ideas about other races. So when I started to look at, discrimination and whether or not this is a recognized problem, when I went to all these different organizations within the last 2 to 3 weeks, after all of the rebellions, riots that are occurring all across the country right now in every state, all of these different organizations have put out some kind of a statement about discrimination and racism. So I wanted to give you just a feeling of some of the things that are being said right now. The American Medical Association recognizes that racism in its systemic, structural, institutional, and interpersonal forms is an urgent threat to public health, the advancement of health equity, and a barrier to excellence in the delivery of medical care. It recognizes that worsening inequalities, unequal access to care, and the disproportionate small number of Black physicians all have roots in the past actions of the AMA. The American Psychiatric Association, their statement, centuries of systemic and institutional racism towards Black Americans has led to decreased access to health care and multiple adverse health incomes. Sandra Schulman, the head of the American Psychological Association, says that we're living in a racism pandemic, which is taking a heavy psychological toll on our African American citizens. The health consequences are dire. Racism is associated with a host of psychological consequences, including depression, anxiety, other serious conditions, including PTSD, substance use disorders, and that also that all of these things can contribute to traumatic reactions in terms of in the African American community. The National Association of Social Workers, the National Education Association, all talked about their commitment to ending racism, and all had information on their websites about ways that people that are a part of their association can reduce racism. When you look at, when I put in racial bias in the National Academy of the Sciences, some of the things that came up were how racial bias is seen in pain management and how that affects like African Americans in terms of seeking treatment. That the risk of African Americans being killed by force is significantly higher than for white Americans. In fact, it is higher for African Americans, people of indigenous backgrounds, both men and women for both groups, and for Latino men. And so another area that is shown an increase is that they've been looking at is the racial bias that happens in terms of in schools, in terms of how African-American children have significantly higher rates of disciplinary actions in comparison to their white peers, and how those higher rates of disciplinary actions can lead to like further ongoing like involvement in the criminal justice system. And finally, the use of force towards African Americans is 13 times higher than of white Americans in situations where they're unarmed and non-suicidal. So all of this information is saying that a lot of the helping organizations that all of us are a part of as being parts of multidisciplinary teams, that all of our national organizations are understanding that racism and discrimination are having significant like impacts in terms of people's ability to access healthcare and healthcare disparities, and also looking at like what types of psychological effects do dealing with all of these things entail. So one of the things that came out of like all of the distress from all of these multiple systemic murders was the Black Lives Matter movement. And so the Black Lives Matter movement came around in 2013 after the murder of, I'm sorry, I said problems with technology. Okay. So the Black Lives Matter movement was created after the murder of Trayvon Martin. And after his murderer was acquitted, one of the chants that started to come out of that movement is Black Lives Matter. And the overall mission of Black Lives Matter is to eradicate white supremacy, increase local power to communities so that they can reduce the violence in their communities. And then also improving Black communities so that we can see increases of Black joy and Black imagination. So for us to have a good conversation about like race and why is it so hard for us to talk about it, the first thing, really, the first thing that we need to look at is in terms of having a good understanding to make sure that we all have the same definition. And one of the reasons why I feel like it is so hard for us to have these conversations is because our definitions are poor. So in terms of race is a power construct. So I've heard throughout my life that race is a power construct and that race isn't real. And so while I read that, I didn't really understand like what that meant in terms of in real life. So in real life, when they said that race was real, I didn't understand what they meant because to me it was real. I knew I could look at somebody and identify exactly like, oh, you're Black, you're white, you're Asian, you're this. But now as I get older, it actually makes more sense to me, especially when we see so many multiracial individuals. I've had the experience of meeting two people that I would identify as Black, and I look at their child, and I would look at their child and think that their child was Caucasian. And so in terms of what race is, these are these collected differences that people kind of put together and said, this is what identifies as Black. This is what identifies as white. This is what identifies as Asian. But that in and of itself, when we look at like genetics, in terms of genetics, we're all way more alike in terms of like, I think the percentage is like 99.6%, something like that, alike than we are different. So we have these outside features, things that we look for to identify and put people in racial categories. So a racist idea is the idea that one group is inferior or superior to another group. When most of us think about someone being a racist, we don't really think about I feel like we think about it in more of a moral way. So the definition of a racist is somebody who supports a racist policy. And that could be through their action, their inaction, or expressing a racist idea. Most of us, when we think about a racist, we think about somebody who's a bad person. We think about somebody who is very negative. And so if we have that idea about a racist being somebody that is bad, it makes a lot of sense why that's not something that we identify with ourselves. Especially if I see myself as a nice, good person, it's very easy to see why I would not identify with some of the thoughts that I have as being racist. An anti-racist is somebody who supports anti-racist policy, and that's through their action or through expressing an anti-racist idea. And racist policies are policies that lead to continuing racial inequity. And so when we're talking about inequity, what we're talking about is often people think about racial equality. So racial equality would be like, if I have 5 beans, I give everybody 5 beans. That would be racial equality. I give everybody 5 beans. Racial equity is making sure that everybody has the same amount of 5 beans. So if the first person has 25, the next person has no beans, and then the next person owes somebody 3 beans, and then I give everybody 5 beans, we don't all have an equal amount of beans, right? So that's the difference between equality and equity. What we're actually looking at is equity in terms of everybody having the equal access to like the same things from the society versus equality. And when people talk about systemic or institutionalized racism, that's what they're talking about. They're talking about those racist policies that lead to racial inequity. So what's racism? That's racist policies plus the racial ideas that lead to the racial inequities. Those racial inequities are what racism is, okay? And then racial inequity, as I explained, is when 2 or more groups are not equal. So in general, why is it hard for us as a society to have these conversations about race? So one of the biggest ones is America is a meritocracy, meaning that America is based on this idea that we're all equal and that we can pull ourselves up by our bootstraps and that everything is based on ability. Well, if everything is based on ability, that goes a lot against about the idea about America that we have, this land of equality, and where we can bring over all these migrants and we can become like this one people and that you can rise up by like your hard work. So this goes a lot against like having this understanding that we all share these belief systems, goes against part of the idea of America. Another idea is social psychology indicates that we generally believe that we're living in a just world. And to imagine that we all have racist ideas goes against kind of like this basic idea about how do we actually see the world. Overt acts are a lot easier to see. It is very easy to say that I'm not racist if my idea of racism is being outwardly mean to somebody. Implicit bias, the things that you can feel but maybe somebody doesn't say out loud, is a lot harder to see and it's a lot harder to deal with. And so it's a lot easier for somebody to say, I did not do that overt thing. It's a lot harder and it takes more work to say that, oh, I have to stop and look at like my bias and how do I see things. The thing that I said at the top, we often have a poor definition that has a morality piece in it. I feel like I'm a great person. I was learning yesterday about some things about Native Americans that I was not aware of that were totally racist ideas. So this is like ongoing work. And often we think that like, oh, okay, I read the book about racism and now I'm not racist anymore, versus that this is an ongoing thing. Lack of practice. In this country, we don't talk about these things. We're often told that to talk about race is bad. I've seen a lot of like things recently in the media in terms of like, I wish people would stop talking about this. If they stop talking about this, that would be better. And so as a society, some of the messaging that we've gotten is that it's not safe, it's not okay to talk about race. The other thing is lack of perspective. That should be an of. So lack of perspective in terms of often one of the things that I talk to like my clients about and that I try to do is sit in the perspective of somebody else. A lot of times if you don't have the perspective in terms of like your privilege where you don't have to put yourself into another person's shoes, you may not. And so some of the times it's hard to have these conversations because people literally don't understand what you're talking about because some of these things have never happened to them, nor do they identify themselves as somebody who would do these things. And then the other last reason is negative feelings. These discussions are hard and uncomfortable. And so a lot of times there's lots of negative feelings in terms of both sides, in terms of the person who has the privilege versus the person who doesn't have the privilege. The person who have the privilege could feel a lot of shame, denial, avoidance. The person who has the privilege can have a lot of shame, guilt, avoidance. The person who does not have the privilege could feel like very angry, very distrustful, very sad. So a lot of these conversations bring up a lot of negative feelings. So all of these are like reasons why people would avoid these conversations. So with having this tiny little bit of introduction in terms of this topic, what can you do next? The biggest thing that I would say is seek information from your perspective in terms of from your national groups. One of the things I was trying to do at first was kind of like come up with these overarching, generalized kind of like things to do. And that's why I started to investigate. We're a multidisciplinary team. We have people that are looking at this from different perspectives. All of the groups have statements currently right now on anti-discrimination, and all of them also had awesome like outlets, resources that you could use in terms of education for yourself, but then also in terms of education, in terms of how to work, in terms of in your area with clients. Some generalized readings that I think will be helpful is How to Be Anti-Racist by Ibrahim X. Kendi. Dr. Kendi is the person where all those definitions and what I was discussing about race comes from. And then the last one are Why Are All the Black Kids Sitting in the Cafeteria and Other Conversations About Race. There's a really good job of discussing like race and racial conversations in terms of for children. And so I would like to leave you with this quote by Dr. Beverly Tatum. Unless we engage in these and other conscious acts of reflection and re-education, we easily repeat the process with our children. We teach what we are taught. The unexamined prejudices of the parents are passed on to the children. It is not our fault, but it is our responsibility to interrupt the cycle. So I hope that this information gives you some like push to go out and to like seek more information to yourself and in your different roles to be able to share it with others. Thank you.
Thank you very much, Kanetta. This was really good.